It's Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, where we also provide home BiPAP, home CPAP without tracheostomy, tracheostomy care without ventilation, home TPN, home IV potassium, home IV magnesium, home IV antibiotic infusions, central line, PICC line, Hickman's line, as well as PICC line port management at home, also cough assist management at home, nasogastric tube, PICC tube management at home, including palliative care. Now, today I want to answer a question from a reader who writes, "Hi Patrik. G'day, my husband is back in ICU now and he's doing well. I think it was planned to put him in ICU for 3 days so that his adult kids could see him. The doctors pretended he was really in. Then he was sent back to ICU on Monday evening. A lot is going on in this hospital. Please assist me and my husband to go home. My husband has been in ICU now since July 2023. The case managers keep dragging their feet. They don't play fair. He's stable, but he's ventilated with a tracheostomy. He's alert and responsive. He was sitting up in bed yesterday to do physiotherapy. He's still a little weak, but he's getting there. The doctors still try to ask him if he wants a PEG tube. He also has stage 4 pressure sores. The speech therapists don't work with him as often as they should. They're holding back his progress. He's tolerating the bolus feeds really well, getting 240 mils 4 times a day. What are the next steps to get my husband home?" Now, here's my response. Now, obviously, this is unfortunately a very common scenario in ICU and ICU step-down units or HDUs or progressive care units. Hospitals and ICUs often delay discharges to keep patients longer than necessary, especially when they don't have the right discharge planning in place, when funding streams are unclear, and if they don't understand the benefits of intensive care at home. Therefore, families and their loved ones often feel stuck and powerless while their loved one could safely continue care at home. Your husband has been in hospital since July 2023, which is way too long. If he's stable, alert, responsive, tolerating feeds, even doing physical therapy or physiotherapy, even though he's ventilated with a tracheostomy, he can go home or at least go to a step-down ICU and then go home. Prolonged hospital stays increase the risk of infections, deconditioning, bed sores. He's already got that stage 4, as you mentioned, and of course, depression. Hospitals are the worst place for long-term recovery because there often is none. This is exactly where we at Intensive Care at Home come in. With our service, we can provide specialist ICU nurses 24 hours a day at home, manage PEG feeds or nasogastric tube feeds safely at home, manage stage 4 wounds with advanced wound care nursing or getting wound care nurses in, deliver IV antibiotics, PICC line, central line, Hickman's line port management at home, work alongside speech therapy and physiotherapy at home, ensuring consistency and real progress. And more importantly, give you and your husband controlled choice and quality of life at home. No need for his kids to go to hospital. They can go to his home. Hospitals, case managers, social workers, ICU staff may drag their feet because they don't want to lose funding and they want to stay in control of how patients live or potentially not live. They often don't tell families that intensive care at home is a real, safe, and most importantly, an evidence-based option. And you absolutely have the right to demand it. The fact that your husband is tolerating bolus feed, sitting up in bed, and is engaging with physiotherapy shows that he's ready to be at home with the right team around him, and we can help you create that right team around him. The hospital is holding him back, not helping him move forward. At Intensive Care at Home, we have helped many families in exactly your situation. Families who were told, your loved one has to stay in ICU forever, or there's no funding for home care, whatever the case may be. That's all nonsense. We wouldn't be in business if there wasn't any funding, or if we didn't know where to get the funding from. Please keep in mind, Intensive Care at Home, we're not only improving the quality of life for patients and their families, we're also cutting the cost of an intensive care bed by approximately 50%. And we're freeing up an ICU bed. That is a classical win-win situation. And everyone wants to win, and that's what we make happen here. And with the right advocacy and the right model of care, we have taken people home and who were stuck in hospitals for months or even years. So the next step, simple, reach out to me at intensivecareathome.com and we can help you with the advocacy, the funding, and the transition home. Remember, the longer your husband stays in ICU, the more progress will stall at home. You will recover faster, have fewer infections, have a much better quality of life, and get the dignity and quality of life he deserves. On top of that, you and your family can stop to live in ICU because currently you're probably living in ICU. Now, with intensive care at home, we are currently sending our ICU and critical care nurses into the home 24 hours a day. We are providing the following: home care services for ventilated adults and children with tracheostomies with critical care nurses 24 hours a day. A genuine alternative to a long-term stay in intensive care or long-term acute care, tracheostomy care for clients without ventilation, home care services for patients on non-invasive ventilation such as home BiPAP, home CPAP, home TPN, which is also known as IV nutrition, home IV potassium and home IV magnesium infusions, IV fluids, and IV antibiotics. We are providing central line management, PICC line management, Hickman's line management, as well as port management at home. We're providing nasogastric tube and PEG tube management at home, the use of cough assist machines for our clients for airway clearance at home, palliative care services at home, as well as ventilator weaning at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going to an emergency department. That also means we're in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs between $5,000 to $6,000 per bed day. Our service costs between $2,500 to $3,000 per bed day, and we're freeing up the most sought after bed in the hospital, which is the ICU bed. Most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. Of course, quality of life is much improved surrounded by families and by a team of dedicated intensive care nurses in the home care setting instead of in an intensive care unit. With intensive care at home, we are currently operating all around Australia in all major capital cities as well as in all regional and rural areas. We work with NDIS clients all around Australia, TAC and WorkSafe in Victoria, Department of Veteran Affairs all around Australia. Our clients and we as a service provider have also received funding through public hospitals, private health funds, as well as departments of health. We are having policies and procedures for intensive care at home nursing, and we've built all the intellectual property for intensive care at home since 2012. No other provider in Australia has created more intellectual property when it comes to intensive care at home nursing than we have. This puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. So if you're at home already and if you're watching this or you're stuck in an ICU long-term, or if you're going to hospital and ED all the time and you realize that you don't have the right level of support at home, or if you are stuck in an ICU, I'll give you a real-world example today how we can help you. One of our first clients when we first got started in 2012 was a client who was at home initially on a ventilator with a tracheostomy with a support worker model 24/7. Of course, support workers are not equipped to look after a client at home on a ventilator with a tracheostomy. That is dangerous and it's simply negligent. Having support workers looking after a client at home on a ventilator with a tracheostomy is like flying the airplane with a cabin crew instead of the pilot, because anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies 24/7, or even at high risk of dying if they don't have a team of dedicated critical care nurses looking after them 24/7 at home. This is actually evidence-based and is documented in our mechanical home ventilation guidelines that you can find on our website at intensivecareathome.com. Think about it. In an intensive care unit in a hospital, you wouldn't have support workers looking after your critically ill loved one or after any critically ill patient on a ventilator with a tracheostomy. So why would anyone in their right mind do that in a home care environment in the community? So this client at the time found out about us eventually, and the ICU that he was basically living in also knew about us and eventually reached out to us. And we were proving our concept with this client very fast. When we worked with this particular client, we sent him critical care nurses 24 hours a day, and he never ever went back into ICU ever again, as long as we were working with this client. We can do the same for you if you're not safe at home and help you with keeping you at home predictably. Otherwise, we would not be in business. Again, the same is applicable for those stuck in an ICU, similar to this case study that I've just given you. Or if you're going back to ED all the time, please reach out to us. We can help you with taking you through the right steps, including how to get funding with different funding bodies. This is also why we are providing NDIS support coordination. We have a team of NDIS support coordinators, and they have a wealth of knowledge. I've done an interview with Amanda Richards, one of our NDIS support coordinators, and I'll put a link to an interview with Amanda in the written version of this blog. We're also providing TAC case management and WorkSafe case management in Victoria with Lucy McCodder. If you're an NDIS support coordinator or a case manager from another organization watching this and you're looking for nursing care for your participants, please reach out to us as well. If you need more evidence for nursing care, we are also writing NDIS nursing assessments with legal nurse, critical care consulting nurses. If you are a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic, and high-performing team of critical care nurses in the community, we're employing hundreds of years of critical care nursing experience combined. You can join this high-performing team if you are a critical care nurse. If you are looking for a career change as a critical care nurse, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, in Warragul, in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I do have a disclaimer though, because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients also do want the same staff coming over and over again because they are so vulnerable and so special. That's why we need regular staff. So if you're looking for agency work where you can come and go, this will not be the right fit for you. We are looking for consistency and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts and you're really keen on building solid relationships with us and with our clients. If you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in your ICU and in your ED for your long-term patients or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. Even if you do pay for it, it is so much more cost-effective than what you're paying for in ICU and ED, and you get the same level of care. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, or for home TPN, please reach out to us as well. We can help you eliminate your bed blocks very fast. If you're in the US and in the UK, and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and with hiring nurses privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website or simply send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next or what questions and insights you have from this video. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.